Hi everyone, welcome to Pharmaoverview. Today's topic is Ozempic a review. In this video, I will brief about what is Ozempic and about its dosing and how to use Ozempic, its precautions and side effects. What is Ozempic? It is a semaglutide injection available in strength 0.25 mg, 0.5 mg, 1 mg and 2 mg. It is a prescription medication and 1 ml of the solution contains 1.34 mg of semaglutide. And it is used to treat the blood sugar in type 2 diabetes along with diet and exercise. And Ozempic is proven to lower and maintain A1C less than 7% when added to treatment plan with basal insulin with or without metformin. It also reduces the risk of heart diseases such as stroke, heart attack and death. And the interesting fact that it is not designed for weight loss, but it helps to reduce the weight up to 6 kg. Mechanism of action of Ozempic. It is a GLP-1 receptor agonist and it is homologous to human GLP-1. GLP-1 is a physiological hormone and its main action in regulation of glucose and appetite in pancreas and brain. It prevents the liver releasing too much sugar and also slows down the food leaving the stomach. Another action is it lowers the systolic BP and reduces inflammation in plaques. Next about Ozempic pen. It is for single patient use only. And the label indicates its strength. If it is red label, it contains 0.25 mg or 0.5 mg semaglutide. And if it is blue label, it contains 1 mg semaglutide. And if it is grey label, it indicates 0.25 mg semaglutide. And if it is yellowish orange color label, it indicates that it is 2 mg semaglutide. How to use Ozempic pen? In the first step, read label and check that your label in the pen contain Ozempic and make sure the medicine is clear and colorless. And before injecting each dose, clean the injection site with rubbing alcohol. And in the second step, push and turn the needle on until it is tight and pull off both needle caps. And the third step, check Ozempic flow with each new pen and turn the dose selector until the dose counter shows flow check simple. And press and hold the dose button until dose display shows 0. And make sure a drop appears at the needle tip. And in the fourth step, turn the dose selector and inject. And in the fifth step, insert the needle into the skin subcutaneously for injection. And press and hold down the dose button, and after dose counter reaches 0, wait and slowly remove the needle. And in the sixth step, after the injection, carefully remove the needle and place it in the appropriate bin. Put the pen cap to the pen. Next about site of administration. Ozempic is injected subcutaneously in the abdomen, thigh or in the upper arm, and do not inject into the muscle or vein. And also change the injection site with each injection. And do not inject in the same area, always choose different spot. Dosing of Ozempic is take one dose once a week on the same day every week. And begin the dose with 0.25 mg once weekly for first 4 weeks. It helps your body to use to the medicine, and then the healthcare provider will increase the dose to 0.5 mg once a week for at least 4 weeks. And use the pen that delivers 0.25 mg or 0.5 mg for this administration. If the patient requires additional blood sugar control, the physician will give 1 mg Ozempic once weekly for at least 4 weeks. For this, use pen that delivers 1 milligram only. If he further needs blood sugar control, then 2 milligram will give once weekly, and use pen that delivers 2 milligram only. And if you want to change the day of the medication, after consulting with your healthcare provider, you can change the medication and make sure that your last dose was taken 2 or more days before. And what happens if you miss a dose? Take the missed dose as soon as possible within 5 days after the missed dose. If it is more than 5 days, skip the missed dose and take your next dose on regular scheduled day. Next, about some precautions have to discuss with Ozempic. Ozempic can take with or without food. And do not share the Ozempic with other people even if the needle has been changed, because it causes infection. And Ozempic is not for use in people with type 1 diabetes. And it's not known if it is safe and effective below 18 years of age. And don't use if you have a family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. And don't use in a medical conditions related to pancreas or kidney problems or diabetic retinopathy. And don't use if you have planned to become pregnant or doing the breastfeeding. Next, about the storage of Ozempic. The general shelf life is 3 years. And before the first use of Ozempic, store in the refrigerator between 2 to 8 degrees Celsius until the expiry date. And if you are using, in use shelf life is 6 weeks. After the first use, store at room temperature between 15 degrees Celsius to 30 degrees Celsius, or in refrigerator between 2 degree to 8 degrees Celsius up to 56 days. And after 56 days, if it is still contains the medicine, it should be disposed of. And should be keep away from heat and sunlight, and do not freeze the product. And in refrigerator, don't place this medicine directly next to the cooling element, and do not use if product is in frozen condition. And keep the medicine away from the children, and keep Ozempic pen cap when not in use. And about the side effects of Ozempic. General side effects are nausea and vomiting, diarrhea, stomach pain, and constipation. And remember, the medication has been more benefited compared to the risk of side effects. And many people are using this medication do not having any serious side effects. And tell to the doctor right away if you have any serious side effects like inflammation in pancreas, changes in vision, low blood sugar, or any kidney problems, gallbladder problems, or allergic reactions. And it is a good habit of carrying some glucose tablet or gel to treat the lowering of blood sugar. And while taking the medicines, nausea and vomiting is a common side effect. And to avoid this nausea, eat low-calorie foods and avoid greasy, fried and sweet foods. And avoid lying down directly after the eating. And eat watery content foods like soups, and also the drink ice cold water. And go outdoor for getting fresh air, and eat very slowly. That's about the brief review of Ozempic. And if you like this video, do share, comment and subscribe. If you find it useful, do subscribe and press the bell icon. Thank you for watching Pharmaoverview. Bye. See you in the next video.